If you're over 60, you've probably felt this before. During the day, you can still manage. But as evening comes, your joints start to speak up. You lie down in bed, your knees begin to feel tight, your fingers stiffen, your shoulders and lower back start to ache, like they just won't settle down. And in the quiet of the night, the pain suddenly feels louder, more noticeable. Many of my patients say to me, "Doctor, I can still move around during the day, but every night the pain gets worse. Is this just what aging feels like?" My answer is always the same. No, that is not the fate of aging. The truth is, nighttime is when your body changes dramatically on a biological level. When you lie down, blood circulation slows, pressure inside the joints can build up. The immune system works more quietly, and your body shifts into repair and recovery mode. If this repair process doesn't happen properly, you may notice more pain at night, shallow or restless sleep, morning stiffness, where the first steps of the day feel the hardest. What's important to understand is this. Many people focus only on what they do during the day, but what you do in the evening often determines how you feel the next morning. My name is Dr. David Warren. I'm 60 years old, and I've spent over 30 years working with adults in their 50s, 60s, and 70s who live with arthritis, joint degeneration, morning stiffness, ongoing joint pain, without wanting to rely on medication. In my clinic, I've noticed something very clear. The patients who improve the most aren't the ones taking stronger medications. They're the ones who change a few key evening habits. These habits are gentle, natural, easy to do at home, and most importantly, designed for the aging body. In this video, I'm going to share simple evening principles and choices that help calm inflammation while you sleep, let your joints truly rest, and help your body start the next morning more smoothly. This is not a miracle. It's not a quick trick. It's about working with your body instead of fighting it. Part 1. Why joint pain feels worse at night and why evening habits shape your morning. Many people believe, "I moved a lot during the day, so of course my joints hurt at night." But it's not that simple. When night comes, your body shifts into a very different biological state. Heart rate slows, blood pressure drops, circulation to the hands and feet decreases. Joints receive less nourishing joint fluid. Here's the key result of that shift. Inflammatory fluids and waste are more likely to linger inside the joints. During the day when you're moving, joint fluid is pumped in and out. Blood flows more freely. Inflammatory substances are carried away. But at night when you're still, circulation slows. Pressure inside the joint space increases slightly. Tightness, stiffness, and pain become more noticeable. That's why some people feel fine during the day, but experience clear joint pain as soon as they lie down. This isn't because you're getting weaker. It's because your nighttime biology isn't being supported properly. Once you understand this, an important mindset shift happens. Evening is not a time to endure pain. It's actually the smartest time to intervene. Many of my patients notice that when they adjust their evenings, they feel more comfortable lying down. They toss and turn less at night. They sleep deeper, even without sleep medication. And in the morning, joints feel less stiff. The first steps feel easier. That stuck joint feeling fades. What's interesting is this. They don't need harder workouts. They don't need stronger drugs. They just support the body when it's most ready to heal. From a clinical standpoint, I always ask patients to remember 3 simple evening principles. Principle 1. Evening is for calming, not stimulating. Avoid eating too late. Avoid intense exercise close to bedtime. Avoid prolonged mental stress. Principle 2. Support gentle circulation. Keep the body warm. Don't let hands and feet get cold. Avoid very cold showers late at night. Principle 3. Nourish joints during repair. Choose foods that are easy to digest. Avoid heavy digestive strain. Avoid triggering nighttime inflammation. With just these 3 principles, you're already laying the right foundation for less joint pain at night. In my clinic, I often say something very simple to patients. During the day, you use your joints. At night, your joints need care. Many people take care of their heart, their stomach, their sleep, but forget about their joints in the evening. When you start respecting your body's nighttime biology, your joints respond in a very clear way, quietly, steadily, and sustainably. Part 2, how to eat dinner. So your joints calm down at night. Most people do this backward. After 50 or 60, the way your body handles food in the evening changes a lot compared to when you were younger. At night, digestive enzymes slow down. The liver shifts toward detox and repair. The immune system becomes more sensitive to inflammatory signals. When you eat the wrong way in the evening, your body has to digest food, manage blood sugar, and fight inflammation at the same time. This pulls energy away from joint repair. Here's something many people don't realize. Nighttime joint inflammation usually doesn't come from movement. It often comes from blood sugar swings, digestive overload, foods that overstimulate the immune system. In other words, your joints aren't worse at night. Your body simply doesn't have the right conditions to calm them. When my patients adjust their dinners, they often tell me, "I feel more comfortable when I lie down. That deep, aching tightness is gone. I sleep deeper and wake up less from pain. Mornings feel lighter, less stiff." What stands out is this. They don't follow extreme diets. They don't skip meals. They just eat in a way that fits the evening. Many are surprised to realize joint pain improves not because of more medication, but because dinner stops fueling inflammation. I usually guide patients using 3 joint-friendly dinner principles. Principle 1. Easy on digestion. Choose soft, easy to digest foods. Avoid fried and greasy meals. Don't eat until you're overly full. Principle 2. Keep blood sugar steady. Limit refined sugar, desserts, and sweet drinks. Avoid large portions of fast carbs at night. Stop late-night snacking. Principle 3. Nourish tissue without triggering inflammation. Include moderate protein. Avoid additives and ultra-processed foods. Go easy on very salty or spicy seasonings. When these 3 principles stay consistent, nighttime inflammation naturally settles down. After many years working with older adults, I've learned one key truth. Your joints don't need you to eat a lot at night. They just need you not to irritate them. Many people eat dinner thinking, "I deserve a big meal. It's night, I can relax now. Eating more will help me sleep." But in reality, eating the wrong way often leads to lighter sleep and more joint pain. When you change how you eat in the evening, you're not just helping your joints. You're helping your entire nighttime recovery system work the way it's supposed to. Part 3. Evening food groups that calm joint inflammation without feeling heavy. When it comes to eating at night, a lot of people worry and ask, "What if I eat and my joints hurt even more later?" That concern makes sense, but the real problem isn't eating, it's eating the wrong kinds of foods. At night, your body doesn't need fast energy. What it really needs is raw materials to repair tissue signals that help calm the immune system, a stable environment so the joints aren't irritated further. The foods that work best in the evening usually share a few key traits. They digest slowly but gently. They don't cause sharp blood sugar spikes. They support connective tissue and joint fluid. When your body receives the right nutrition signals, it understands this is repair time, not an emergency. People who choose the right evening food groups often notice joint tightness easing as they lie down, less heat or deep aching inside the joints, deeper sleep with fewer awakenings, and in the morning, joints feel easier to open up. That dry, grinding feeling with movement is gone. One important thing to understand, these changes usually happen quietly, not as pain gone overnight, but as each morning feeling a little easier than the last. Instead of memorizing specific foods, I encourage patients to remember 3 joint-friendly evening food groups. Group 1, light protein, to nourish tissue. Moderate protein helps repair joint tissue, keep the muscles around joints strong. Best choices are soft, low in fat, easy to digest. Group 2, healthy fats, to calm inflammatory signals. A small amount of healthy fat helps prevent the immune system from overreacting, keep joint fluid more stable, avoid fried fats and heavily processed oils. Group 3, foods that support relaxation. These foods help calm the nervous system, Relax muscles, support deeper sleep. When these three groups are present in the right amounts, your joints are nourished without being overloaded. I often tell my older patients, evening is not the time to eat until you're full. It's the time to eat so your body can repair. Many people think, the more I eat, the stronger I'll be. If I don't eat, my joints will weaken. But after 60, eating right matters far more than eating more. When you give your body just enough fuel at the right time, your joints will quietly do the rest of their work while you sleep. Part 4. One evening. Habit that isn't food, but helps joints heal better. Overnight, many people believe, as long as I eat right, that's enough. In reality, nutrition is only half of recovery. The other half depends on the state of your nervous system and circulation before sleep. After 50 or 60, the nervous system often becomes more sensitive to stress, harder to fully shut down at night, stuck in a low-level alert state. When the nervous system doesn't truly relax, blood vessels stay slightly constricted, blood flow to the joints drops. Pain signals become amplified. That means even if you eat correctly, your joints still struggle to recover if your body hasn't fully relaxed. Patients who add a simple evening relaxation habit often tell me, my body feels noticeably softer when I lie down. My joints feel less tense and restless. I fall asleep more easily and toss less. I wake up feeling lighter, not heavy and stiff. What's important is this. They don't do anything complicated. They don't use special equipment. They simply help the body shift into true rest mode. I usually guide patients to follow a very simple pre-sleep routine based on 3 elements. Element 1. Comfortable warmth. Keep the feet and lower legs warm. Avoid sudden exposure to cold. Gentle warmth allows blood vessels to relax and improve circulation to the joints. Element 2. Slow, steady breathing. Breathe slowly, deeply, and evenly. Inhale through the nose, exhale slightly longer. Slow breathing sends a safe signal to the brain. Element 3. Reducing stimulation. Lower bright lights. Avoid phones and stressful news. Let the brain know the day is over. When these 3 elements come together, the nervous system shifts into recovery mode, helping to reduce muscle tension around the joints, lower pain signal amplification, improve how the body uses the nutrition you've eaten. I often tell patients, the body only repairs well when it feels safe. Many people eat dinner and immediately scroll on their phone. Worry about their health, lie in bed thinking about everything. All of that keeps the nervous system tense, and tense joints don't rest well. Just 15 to 20 truly quiet minutes in the evening can help your body do something pain medication can't. Give your joints a real chance to heal naturally. Part 5. Turning everything into a simple evening recovery sequence. The human body, especially the aging body, works best with consistent rhythm. The brain loves repetition, repeating meal times, repeating evening routines, repeating pre-sleep signals. When a habit is repeated long enough, the brain lowers alertness, reduces stress, activates recovery hormones earlier. This means it's not single actions that make the difference. It's the same sequence in the same order every night. If you do it one night and skip the next, the body never fully learns. But when you're consistent, the body automatically shifts into recovery mode at that time. Patients who follow an evening recovery sequence often notice nighttime pain decreasing steadily instead of flaring unpredictably, deeper sleep without medication, fewer awakenings from discomfort, and in the morning, less joint locking, less time needed to get moving, more stable mood. The key point is this: they don't have to think about what to do anymore. Their body already knows the path. I usually suggest a very simple 4-step evening recovery sequence. Step 1. End dinner gently. Don't eat until overly full. Avoid prolonged snacking. Let digestion rest early. Step 2. Create relaxation signals. Soft lighting, no stressful news. Slower pace. Step 3. Support the body. Keep warm. Breathe slowly. Relax muscles. Step 4. Go to bed in a calm state. Don't carry worries into bed. Don't force a sleep. Allow the body to drift naturally. This sequence doesn't need to be perfect. It just needs to be consistent. After years of working with adults over 60, I've learned one simple truth. The body doesn't need you to push harder. It needs patience. Many people give up because they expect results too quickly. They compare today to yesterday. They feel discouraged when relief isn't immediate. But joints don't heal like flipping a switch. They heal little by little, night after night, when given the right conditions. If you maintain this evening sequence, after 1 week, sleep improves after 2 to 3 weeks. Mornings feel lighter. After 1 to 2 months, joint response becomes clear. If there's one thing I want you to remember after this video, it's this. Your body still knows how to repair itself, even after 60 or 70. The problem isn't that your joints are worn out, it's that at night your body hasn't had the right conditions to do its job. When you eat more gently in the evening, avoid inflammatory triggers before bed, truly relax your nervous system and maintain a consistent evening routine, you're doing something very important, giving your joints the time and environment they need to heal. Many of my patients once believed, I'll probably have to live with joint pain forever. But when they changed how they cared for their evenings, they realized pain no longer controlled their sleep. Mornings were no longer a battle with their body. And most importantly, they regained a sense of control over their health. If you're over 60, please remember this. Your joints don't need more effort. They need understanding and the right care. If this video helped you understand your body better, please subscribe so I can continue walking this path with you, sharing advice that's practical, safe, and designed for older adults. And if you saw yourself in what I shared today, leave a comment. I read everyone, and I truly value your story. Disclaimer: this video is for educational purposes only and does not replace personal medical advice. If you have specific medical conditions or are taking medication, please consult your healthcare provider.